vein disease and venous insufficiency was not something that was out there in front of the medical community, people addressing. It's only a recent development where people have recognized how common it is, number one, also how debilitating it can be, but also when you look at the new quality of life studies, is treating these patients, they get such a tremendous benefit, such a tremendous improvement in the quality of life. It's a greater improvement than treating other disease processes of the legs like arterial disease. Venous insufficiency is much more common than heart disease, much more common than peripheral arterial disease, and the treatment actually is much more effective, much more durable, much more curative, and patients typically have a greater increase in the quality of life than treating other disease processes. People come in and say, at the end of the day, my legs feel tired and heavy. They describe leg fatigue. On their feet all day, they will say their legs just bother them. They have cramps, may have night cramps, they'll have pressure sensation. Some of the later symptoms when patients start having an inflammatory reaction, they have burning and itching. Some people describe it as fire ants crawling around their ankle. Patients with venous insufficiency usually have a slow onset of symptoms that have been going on for many, many years. The symptoms are very vague, nonspecific, and the onset is so gradual, they really don't know what they are. After treating these patients, they come back after they heal, and they are generally in a state of disbelief that they've been living with this for so long. And one of the most common things they tell me is, Doc, I wish I would have taken care of this 10 years ago. And then at some point, sometimes they become frustrated that they didn't find out about this until recently, that they could be treated on an outpatient basis with a minimally invasive procedure and have their symptoms resolved, essentially. People are finally becoming aware of it, and the public actually, patients are looking for us, looking for treatment. They're finding out their friends got treated, their uncle got treated, and they're reporting that they feel much better. And now patients are actually looking for us. They're going to their doctor saying, hey, my legs are bothering me, I think it could be my veins. And then we're getting more patients referred from doctors who are finding out the information from their patients themselves. Also, we're in constant education mode where we're educating the public, educating patients, educating referring physicians. It's been only about 10 years that people have known that these treatments are very effective and how common this disease process is. If a person's been in practice for 20 years, it's very hard for people to keep up on all the new technologies, because before, treatment was vein stripping. You had to go in the hospital, you had to be admitted, you had to stay a few days, you had a procedure which was quite brutal. It was painful, recovery process was very long, didn't work very well. The recurrence rate was so high, the disease was actually not as bad as the treatment, so people didn't get treated. Nowadays, the treatment is so effective, so much more durable, and so benign in comparison that it opens up opportunities to treat a lot more people who have a lot better results.